I'd like to share with you some stories about children who have learning and thinking differently problems. These are children who often present in different ways. They often become quite frustrated and confused as to what to do. And you know, every day I see parents who come into my room and they've submitted a lot of information beforehand, and they start telling me what is really wrong. They tell me from their hearts exactly what they're concerned about. They've been often on a journey. They've had many people tell them. They've been to different doctors. They've had lots of opinion. They started off often at school, teachers talking about particular problems. And there are three main categories that I see. It's often a child, whether it's a boy or girl, who doesn't really seem to have problems at home. Parents don't see, they don't complain about problems. They're often wonderful children. They don't have any malicious bone in their body. They don't have behavior problems. They're not overly impulsive. They get on with the rest of their siblings. They're generally quite compliant children. They don't cause problems. And in the past, they haven't caused problems at school. When they visit grandparents, friends. But if you think about things very carefully, there's often a little bit of a problem with routines. They have difficulty getting going in the morning. Parents have to do a lot more for them. And you know, if it's your first child as parents, who do you compare them to? And that's difficult. How do you know whether your child is functioning according to what they should for the age? And that is the key. Is your child doing the things that they should do for a child of their age? And that's a tough thing to ask and know the answer to. Because who do you compare it to? I often see parents who have to do a lot more for their child. And they naturally do this to make their child feel secure, safe, and not apply too much pressure. So when the child goes to school for the first time, as they progress, as they go through each grade, parents are having to do a lot more in the morning for them. They're having to check on them, wake them up in the morning. They're having to make sure that they dress correctly, get all their things together. They need coordination with that. They need a little bit of help with their dressing. They're going to be reminded a lot more. But because the child is not a difficult child, it doesn't seem like an unreasonable thing to do. So parents don't know it, but they are almost treating that child or their child like someone who's a bit younger. But when you're the parent, you don't see that. And when the child starts to go to school, that is when there's almost a bombshell that's been launched. Only too recently, I've seen parents and heard parents say, you know, the last couple of years, I've had no problems. The teacher before COVID had no problems with my child. We haven't heard one problem at all. And yet this year in the first term, there really is an issue. The teacher seems to think that my child has a learning problem, not finishing work. They don't say they've got a learning problem, but they've got a difficulty finishing work. They don't have any behavior problems. And then as the term goes on, there's a lot more pressure. Your child seems to be under a lot more pressure. They tend to be a little bit more anxious because they're having to finish work. They're falling behind the rest of the children in class. They don't have to be told that they're falling behind. They know, they can see that. They are children that want to please. They're not difficult children, they're not lazy. They're wanting to do that work, but they just don't seem to be able to finish it and do that work. And that's a very typical thing I see. And that child is often treated for different medical problems. They've seen psychologists, They've been seen by occupational therapists for coordination difficulties, muscle core problems. They're not sitting up in class with straight backs, seem to slouch. They've had tests for allergies, iron tests, trying to find other reasons. Parents go to pharmacies, buy lots of supplements, things that boost the concentration, omega-3s, omega-6s, things that will enhance their ability to function in class. And cut out technology, making sure they don't get exposed to TV, online games, tablets, all the technology. And nothing seems to be happening. And then parents become very frustrated. And that is when I see children. And my job is to help parents understand what is the problem. And very quickly I'm able to see from the teacher's report the child's inattentive, daydreaming, not finishing, spacing out. They're having to be redirected. The teacher's having to put a bit more pressure on the child. That causes anxiety. And we delve deeper. Often hear from one of the parents that they had difficulty at school. But you know, back in the day, these things weren't recognized. Schools, structure, all those things back in the day didn't seem to highlight the problems. And it's not a matter of a child having busyness, hyperactivity. Those are obvious problems. These are children that slip through the net, as it were. And you know, if they're not picked up early and identified, that child misses out a lot. It's almost as though they're present in body but not in mind, missing almost 2 days a week at school. That's 40% of their education. And it's so difficult to understand where the problem's coming from for parents, because it's something that happens so subtly over time. I like to think about it as almost the diabetes of the mind. Diabetes is a condition that can start very subtly, with sudden little changes in sugar. A little bit high sugar can cause to increased urination, can cause sometimes some headaches, but gradually that condition suddenly becomes manifest and obvious. It can cause problems with heart problems. Diabetes causes problems with cholesterol, kidney problems, eyesight, blindness, loss of limbs, early death. It's something that happens over time. You see, ADHD is a problem that is not always obvious. If a child is difficult, has behavior problems, those children present so early. In a way, it's easy to identify them because no one seems to have a problem, because parents experience that problem at home. When you have a problem at home, it's real. But when there's a problem that someone else says you have, that's difficult to accept, because we're using our own reference from when we were brought up. Unfortunately, doctors are not trained to identify these problems, and mental health is something that's going to be a huge challenge in the future. We need to invest more in understanding. So that is where I tend to come in. I see parents with these kind of problems, and it's taking them through a journey to help understand. And that's where I've got a 5-step program. I believe that I like to think about it almost like sitting at this table. It's got 4 legs, and each of those legs represent an important stage. And only when you've got that sorted, when you've got the stability of the table, can you put something on top of it, whether it's a dining room table and you have a meal. But only once that table is stable can you talk about treatment and going forward. It's difficult for parents to understand that understanding something and having the ability to really have a deep understanding. If you can understand things, you accept. And that is the first leg. it is the acceptance of what the problem is, not just the symptoms. What is causing the problem in the brain? What is the problem? It's an immaturity of the developmental part of the brain with the 7 functions, of the 7 executive functions. The mind's mirror, the mind's eye, the mind's ear, the mind's brake, the mind's heart, the mind's fuel tank, the mind's playground. These are things I'm going to help you understand. And only once you accept can you then get to the point where you make a diagnosis. And understanding what a diagnosis is, collecting information, rating scales, information, simulating this amazing 6K resolution of a picture of everything. The more pieces you get, the better the picture, the better the diagnosis, the more accurate the diagnosis. And only then can you get help. That's the H, that's the third leg. Getting help for yourself, looking for sources of information, healing at home, taking ownership, becoming that executive parent. And then you can embark upon a long-term journey of direction. It's a process. ADHD is not a sprint, it's a marathon. It's the comrades marathon. It's not the 100-meter Usain Bolt sprint. It's rather be the hare or the tortoise. The tortoise goes along and it doesn't deviate, it goes in the correct direction. The hare starts 5 races but doesn't finish 1. So rather be the tortoise than the hare. And only once you've got that direction can you then start talking about medication. Medication instills a lot of fear. Parents think about addiction, they think about all the myths. But I've honestly got to tell you, it is one of the safest treatments available for children. If it's well managed by somebody who understands it, it is extremely effective. It is one of the most effective medications we have in pediatrics. It helps children in over 80%. It almost normalizes the symptoms in over 60%. It helps the development, the stimulation of the brain. That medication helps grow the brain. It helps the self-control. It's like pouring brake fluid on the system. Brake fluid on the front of the brain helps self-control. It helps protect the brain. It does treat the underlying problem. It's the root cause of the problem is that lack of neurotransmitter called dopamine in the front of the brain. And there are other ways to go about managing, not only medication, exercise, behavior programs, support systems for parents, being part of a community, connecting. Vitamin C or the connect vitamin, highly important. Those that connect, reach out, connect, get help. Connection improves your life expectancy. And then, of course, we go beyond that. There are other new treatments that are being discovered. By giving that support, creating the right environment, epigenetics helps switch on genes that weren't switched on. Those that were switched off get switched on. Help enhance your child's ability. And then there are interventions with occupational therapists for sensory problems. They're the comorbidities, those things that are associated with it. Over 50% of children have learning disabilities, reading, writing, spelling, all those type of problems. Those need to be dealt with. So my job is to help you understand that this is a huge problem if it's not dealt with. ADHD untreated is more dangerous than having diabetes, high blood pressure, obesity, cholesterol, smoking, drinking, drug abuse altogether. So it's an important thing to understand, deal with, but I will help you on that journey. And I hope you'll come along with me.